Let me ask you something. Do you still balance a checkbook? If so, have you had problems recently? Or any other problems associated with personal finance that maybe you didn't have before? Other math problems that you maybe didn't have before? How about word finding? As you have seen, if you've seen any of my videos, I have some challenges with word finding. Fortunately, a key item here is that you haven't had before. My word finding problem started when I was 10 years old. And in fact, they're better than they used to be. So I've been reassured multiple times that's not as usual. One of the first, here I go again, one of the first indicators of potential cognitive decline. So there's a much better way of measuring cognitive decline and cognitive capability. It's called the Mini-Cog. I'll go over that a little bit later today, or in this video, but let's talk for a minute about a couple of other things. How about this? What if you're just turning 60s or 70 and you know you have insulin resistance? Why would that have anything to do with wanting to take a look at your cognitive abilities or potential cognitive impairment? Well, number one, there's a lot of evidence, and Dr. Dale Bredesen, the author of The End of Alzheimer's, is very emphatic that for those of us who have cognitive impairment, mild cognitive impairment, that's the time when you can really make an impact. So there's debate over that. I'm not going to get into that issue today. What I am going to get into, again, is the Mini-Cog. And but first, a quick introduction. Ford Brewer, F-O-R-D, B-R-E-W-E-R, with PrevMed, heart attack, stroke, dementia, disability prevention. Now, real quick, what has the Mini-Cog got to do with a YouTube channel that started out on cardiovascular inflammation? Well, let's go through the logic real quick on that. What's the number one cause of heart attack and stroke? Cardiovascular inflammation. What's the number one cause of cardiovascular inflammation? Insulin resistance, diabetes. What's the number one cause of dementia? Insulin resistance, diabetes. In fact, there's some evidence that 100% of dementia is experienced in association with insulin resistance. Even those folks that don't have measured insulin resistance in their body, there's plenty of evidence that they have what's called insulin resistance of the brain. Again, we'll talk about that a little bit later in a different video. Today we're just talking about the Mini-Cog and what it looks like. But a real quick couple of comments about diabetes and aging. So if you take a population with obesity, a population with diabetic risk factors for insulin resistance, and a population that's aging, which population is most reliably going to show insulin resistance? The third one. Aging is, believe it or not, and there's a lot of debate about that too. We talk about obesity being the number one cause of the insulin resistance or diabetes epidemic. I would say no. I'd say it's aging. But it doesn't matter. Here's the thing. UCLA, University of California, Los Angeles, published a study last month indicating that over half of adult Californians, and I believe they defined it as 30 years or older, over half of adult Californians have insulin resistance or full-blown diabetes. So with that many people getting insulin resistant and diabetes, we need to be looking at cognitive impairment. Again, type 3 diabetes. So, the Mini-Cog, let's talk about that for a few minutes. First of all, a quick mention of a couple of resources available for cognitive impairment and cognitive performance management. On the Alzheimer's Association, there's a very good cognitive impairment care planning tool. It has a lot of different tools within it, one of them being the Mini-Cog itself. Plus, and in fact, that's where I got this version of the Mini-Cog. It's also got some instructions on how to do the Mini-Cog. We'll actually do a brief Mini-Cog as part of this video. But before we do, let's take a look at the literature around the different types of cognitive assessments. This is one of the best. It's one of the most cited, and it's in one of the best journal areas. It's cognitive tests to detect dementia, a systematic review, and meta-analysis. Meta-analysis meaning they looked at all the reviews they could find, and this is by Kevin, K.F. Tsoi, T-S-O-I, JAMA Internal Medicine 2015, and I'll put that citation in the having a word finding problem there. I'll have it in. I'll put it in the bottom in the write up under the video. So here's what they said. Basically, they started out with what they considered to be the industry standard in this area. It's called the MMSE, the Mini Mental Status or Mini Mental State Examination. Now, one of the problems with the MMSE is it's proprietary. So, you know, they can basically charge what they want if people insist on using that one. So they looked at 11 other screening tests, 49 studies, over 49,000 participants total in terms of looking for the quality of cognitive impairment testing. Now, the studies most used were the MMSE in 102 studies, 10,000 patients. The combined sensitivity and specificity were really good, 0.81 and 0.89. Now, the other 10 tests, among those, there were two that came out very, very well. One is the Mini-Cog. The other is Addenbrook's Cognitive Examination, the ACE exam. The Mini-Cog was 0.91 sensitivity, better than the MMSE, and 0.86 specificity, almost as good as the MMSE. Now, the Mini-Cog is extremely popular. Most folks that are doing this start off with the Mini-Cog. One of the reasons for that is that these numbers that we just reviewed, if you go through research, it's a very, very good test. There's another critical fact about the Mini-Cog that you need to be aware of as well. It takes less than 3 minutes. And obviously it's been, well, maybe it's not obvious. It has been validated in use of primary care. It's a simple test. I'm going to show you how to do it. We'll run through one in just a minute. It takes less than 3 minutes. Primary care folks have done it for a while, and it is both sensitive, meaning it will pick up problems if there are cognitive impairment problems, and it's specific, meaning it doesn't just bring up a bunch of junk. If there are problems with cognitive impairment, it shows problems with cognitive impairment. Now, there are a couple of major components of it. One is a clock draw. The other is a 3-word recall. So, what you do is you tell the patient, look, in fact, it reads out exactly how we want to do this. Look directly at the person and say, please listen carefully. I'm going to say 3 words that I want you to speak back to me now and try to remember. The words are, and you can choose any from this. This one is banana, sunrise, and chair. So think about that. Repeat it back. Now, If you can't repeat it back, you score a 0 on this coming out of the blocks. Now, and again, we can use others, Captain Garvin Picture, Daughter Heaven Mountain. But we're going to do that again a little bit later. But first, we're going to draw the hands of a clock. Now, here's the directions for that. Next, I want you to draw a clock for me. First, put in all the numbers where they go. When that's completed, say, now I want the hands set to 10 past 11. Now, use a pre-printed circle. And they give you a pre-printed circle in this Alzheimer's Association care plan. So give them this and draw it out. And I'm going to do that real quick. One of the things that they want you to do is look at the numbers to make sure the numbers are all there. Another thing they want you to look at is whether or not the hands are there. And let me see, what was the time they wanted? 10 past 11. So I want to take the long hand and put it on the 2, and the short hand and put it just past 11. As you might have guessed, I may have practiced this a little bit. That's the first time I've actually drawn one, but having read this and done a lot of these, and in fact I can give you some clues. First put in the 10, 6, the 3, and the 9. Then put in the long hand, because the long hand points to the actual number, and then the shorthand, you want to put it a little bit past the hour sign, depending on where your number is. Now, I'll go over a little bit of the scoring on this. First of all, now do you remember those 3 words? A little bit of a clue on that one, too. The first 3 words that we read were chair, sunrise, no, banana, sunrise, chair. Yep, banana, sunrise, chair. Here's a clue on how to remember words in a string like that too. You want to create a picture. So the picture that I created in my mind was I'm at a beach, sitting eating a banana. It's sunrise, and I'm sitting in one of those wooden chairs on the beach. Now, again, you might say I cheated, but because I've practiced and I know these some of these techniques. But let's talk about scoring on this. On the word recall, you score anywhere from 0 to 3. You get 1 point for each word spontaneously recalled without cueing. Cueing means you have to remind them. On the clock draw, the normal clock equals 2 points. A normal clock has all the numbers placed in correct sequence in approximately correct position. 12, 3, 6, and 9 are in the anchor positions, and no missing or duplicate numbers. Hands are pointing to the 11 and 2, and hand length is not scored. So I showed you how to do that on there, but that's not scored. Inability or refusal to draw a clock is 0 points. Total score equals the word recall score plus the clock recall score, and a cut point of less than 3 on the Mini-Cog has been validated for dementia screening. So in other words, if somebody takes this, it takes less than 3 minutes to do it. If they score less than 3 on this, that's a significant concern for dementia. A cut point of less than 4 is recommended for greater sensitivity, and you basically, if you see less than 4, you really should start doing a deeper exam like the MoCA, the Montreal Cognitive Assessment. For those of you who wonder about, well, how can you get that wrong? Here's how you can get that wrong. Now, these are different levels of lowering scores on that clock face test. I think it may be pretty obvious how you can get things wrong on the word recall, But look what can happen on the clock face. You start losing the numbers, you start losing the sequence of the numbers, you start losing the actual hands, you start putting, these are some actual clock face tests that have been done. So what we did today was go over a Mini-Cog. We actually did a Mini-Cog, and we talked a little bit about cognitive impairment and risk factors like diabetes. Thank you for your attention.